Nurse Cecilia Ibeabuchi prepares for each visit to her clinic the same way, with a foot basin and fresh liner.
Like you go in the salon.
A warm, soapy bath.
Every single patient that comes to Foot Care Clinic gets a bucket of water made this way.
Her patients are residents of Boston who are unhoused, a community she cares about deeply. Now 64, Cecilia was 24 when she came to the U.S. and settled in Roxbury. She was stunned to see people struggling.
I said to my husband, "You mean that people are homeless in America? That's unbelievable." I knew I have to do something.
That something started with study. She earned a bachelor's degree in biology, then nursing and master's degrees. She started working at Pine Street Inn.
This is a huge problem. It's not a simple, easy problem that one person can solve.
But Cecilia knew one person could make a difference, and her decades of work at Boston Healthcare for the Homeless program is proof. Their foot clinic at the St. Francis House was Cecilia's creation more than 20 years ago. For many, walking is their only mode of transportation.
Some walk half a mile, some 2 miles, 3 miles a day. To find food, shelter.
Cecilia sees it all.
These are actual people's feet that we have.
From simple calluses to frostbite, fungal infections to immersion foot.
Nobody, when they were born, said, "I would like to be homeless." I know I can help a human being. And I know if I treat those feet every day, I can get it healed and back to life, and they will feel better.
Cecilia has really been a model for our program and how a nurse that is passionate and compassionate can change lives.
Not just the lives of her patients, but other medical professionals. April Ramsey, who heads up clinical operations, says many students come here to learn from the woman lovingly called Boston's Foot Lady.
I would love to have a number of the amount of medical professionals that have gotten their start in the foot room. It's just a testament to Cecilia's unwavering dedication.
Cecilia says by offering simple comforts many take for granted.
Some may want ankle socks.
Along with the highest quality of care, she can build trust, and that enables patients to find their footing in many ways.
When they come in here and feel good about their physical problems, now we can engage them into getting housing, engage them into having other connection with their families that they have lost. That's what we're doing here. Foot care, then cut those barriers, trusting relationship into primary care. They're sick, they can call you, they come and be seen. You've saved life.
Cecilia doesn't like all the attention, but we wanted to highlight her work because she's remarkable, obviously. Also, she's leaving a longtime role. She's been a supervisor, but recently decided to step back from managerial duties. She will still be caring for patients, which is obviously her passion. Erica Tarantel, WCVB News Center 5.
So take a